This video we are going to see the radiological features of scurvy. So in this radiological features of scurvy, firstly we're seeing the questions. The first question is, what is the Wimberger's ring? What is the Wimberger's ring and where it is seen? Second question is, what is the Trummerfeld zone? So what is the Trummerfeld zone is the second question. The third question is, name all the characters, all the radiological features. Just the headings. What are the radiological features in case of the scurvy? So we'll find out all these answers in this video, and some questions for the comments will be given at the end of the video. So looking at the radiologic features, the first one is the generalized osteopenia. Next, there is presence of the pencil point cortex. So what is a pencil point cortex? Pencil point cortex is nothing but the cortical thinning is called the pencil point cortex. Next, we are also able to see the periosteal reaction. So the periosteal reaction is due to the subperiosteal hemorrhage. Next, we see the scorbutic rosary. The scorbutic rosary is nothing but the expansion of the costochondral junction. Next, there is also the heme arthrosis. Next is the presence of Wimberger's ring. Wimberger ring. So what is the Wimberger's ring? We will know this. So the Wimberger's ring is circular. Wimberger's ring is circular. It is an opaque. It is a radiological shadow. And it is a radiological shadow which surrounds the epiphyseal center. So epiphyseal center of the ossification, and it may also result in the bleeding. Next, what we see is there is the Frenkel zone. Frenkel line. So what is a Frenkel line? Frenkel line is nothing but it is dense. The dense zone. It is a dense zone of provisional calcification. Then we move on to the Trummerfeld zone. Trummerfeld zone. So what is a Trummerfeld zone? The Trummerfeld zone is a lucent. It is a lucent metaphyseal band. So it is a metaphyseal band. It underlines. There is underlying the Frankel line. So it underlines the Frankel line. Next we see is the Pelkin spur. So what is a Pelkin spur? Pelkin spur is nothing but it is a metaphyseal. It is a metaphyseal spur. And it results in cupping of the metaphyses. So now we'll look at the answers to our questions. So the first question we asked was, what is the Wimberger's ring? So the Wimberger's ring is nothing but it is circular, and it is opaque as well. It is a circular, opaque radiological shadow. And what it does, it surrounds the epiphyseal centers. It surrounds the epiphyseal centers of the ossification, and it may also result in the bleeding. Next, we move on to the next question, that is what is the Trummerfeld zone? So the Trummerfeld zone is nothing but it is a lucent metaphyseal band. It is a lucent metaphyseal band, and it underlies the Frankel line. It underlies the Frankel line. Next, we look at all the features of the scurvy, radiological features. So just to name them in heading, there is generalized osteopenia, there is presence of the pencil point cortex, then there is also the periosteal reaction, there is scorbutic rosary, there is also presence of the hemartosis, there is also the Wimberger's ring, there is a line that is the Frenkel's line, there is the Trummerfeld zone, as well as the Pelkin spur. So now we have some questions for the viewers that has to be answered in the comments. So the first question is, what is scorbutic rosary and which condition it is seen? Next is, what is exactly the Pelkin spur? So the answers can be found in this video as well. So the last question is, what is a pencil point cortex? What does it indicate?